administrator at Clear Passage Physical Therapy. I've been with Clear Passage almost 6 years now, and I love Clear Passage about what we do to help people that come with us with small bowel obstructions or even blocked fallopian tubes. I'm in the back, I don't do any of the patient contact. I pretty much help the patients after they have been scheduled. I help them, make sure they have all their paperwork in, make sure they get their super bill at the end of their treatment. Clear Passage is a wonderful place to work. I wouldn't trade it for anything in this world, and it makes me feel really good when I walk out of here in the afternoon, knowing that I have helped someone on their journey to either clear up small bowel obstruction or to help them get pregnant, and that's a wonderful feeling. So now I want to introduce you to Ginny Anstead. Ginny was a CP patient. She came to Clear Passage 21 years ago. She did so well with CP that she became a patient coordinator with CP, and she has helped so many people get their feet in the door to become patients at Clear Passage. Now she is retired. Before we get into Jenny's story, let's just get a little about Jenny's retirement. How is your retirement, Jenny?
It's been great. It's totally different. I do a lot of reading. I do some gardening, eating, just pretty much whatever I want to do when I want to do it, which is unusual. I do miss my patients because they give you so much as you see them get better. But there comes a time in life when you have to retire.
Hmm. Hmm. Well, we do miss you here. I just want you to know that. But life hasn't always
Thank
been
you.
wonderful for you. Would you please tell us how you get your first bowel obstruction?
Well, I had had 10 surgeries before I had my first full obstruction. I had been having years, probably 10 years of pain, where I would go to the doctor with abdominal pain and they really couldn't tell me what it was. I thought it was gas. I get the most horrific positions trying to get rid of that. Uh, Basically, I got patted on the head and made to feel insignificant and like it was all in my head.
Mm.
Then I had my first full on obstruction, and it validated what I knew was going on. I knew something was wrong, but nobody had answers. And it was the most frustrating. I stopped traveling. I stopped doing anything. My life was just constant, constant anxiousness and fear.
Mm. That's really sad to hear. But a lot of patients, a lot of our clients feel lost and frustrated. Can you talk more about that? And did you have any help from the medical
You
profession?
know, after one time, uh, a woman told me about Clear Passage. I had just gotten out of the hospital with, I think it was a 5 or 6 day stay, and she told me about Clear Passage. She was a patient here, and she was seeing a different doctor than I was, so her doctor knew all about it, but mine didn't. I went in and I saw my doctor and told him about it. He took the time to go on the website and actually look and read and turned back around and said, "You know, it makes perfect sense. Try it.
Mm.
You have nothing to lose. You can't keep going on like this."
Mm-hmm.
And I did. And it was the beginning of the most amazing journey I have ever been on in my life.
That is awesome. That is awesome. We have a lot of people talk about the NG tube and how they're afraid to, plan any social activities because they don't know if they're going to end up in the hospital and have another NG tube put in. What was
Oh,
that like for you?
that thing is the most horrible contraption ever made by man or a woman.
Mm.
It's a tube that goes down your nose into your stomach and pumps out any accumulation. Of course, at this point, you're already curled up in a ball in pain and either dry heaving or throwing up.
Mm.
So, trying to get that down while drinking, they're telling you to drink a glass of water, and you're trying to drink that water, and it's horrific. It's, I called it the tube from hell. It works,
Mm-hmm.
but it makes your life for a few minutes just pure agony.
Mm. Wow.
After it's in, the pain is let up some because they're getting all the crap out of your system.
Mm-hmm.
Then they hook you up to IV. Well, of course, they've already got you hooked up to IVs. And then it's nothing by mouth, and you just sit there.
Mm.
Uh, Pain medication that they give you is helpful, but it slows the intestines down, so you don't want to take it like they want you to.
Mm-hmm.
Because if you do, you're slowing your intestines down, and it means you're going to be in there longer.
Wow.
You're
Wow.
spending your time. For me, it became fighting with doctors. I met a doctor that told me I didn't have to have surgery. And I had already had 4 surgeries at that point, 4 bowel obstructions. And I met a surgeon when I moved to Florida, and he said, I'll sit with you, I'll work with you until if it becomes a total obstruction, then you have to have surgery.
Wow.
One time it was 15 days.
Wow.
Uh, Another time it was 9, and I got his coworker, and his coworker had never heard of Clear Passage. My doctor had left for vacation. So it was 9 days of fighting with this man. He doesn't like me much to this day. Well, I had breast cancer about 6 years ago, beat it. But coming out of my surgeon's office, I ran into this guy. He looked me right in the face, turned around, and walked the other way.
Wow.
Yeah, he didn't like me much because I was very adamant that
Mhm.
we weren't doing any more surgery.
Right. Right.
Clear Passage changed my life, it changed my future. And for 21 years, I have done the manual manipulation that they taught me. It's a self help thing. After they do their thing and they get everything working, then you do a ongoing, and it only takes about 8 to 10 minutes a day,
Mm-hmm.
and
Mm-hmm.
stick to the diet. And I've had 21 years of good. I
That is
mean,
awesome.
I couldn't go 6 months before.
Right. That is awesome. I mean, that's a wonderful story. And just to see you and how beautiful you are and how
Oh,
good you're doing. And all of that is, pertaining to Clear Passage. That is wonderful. So, Facebook, before we go on, if you have any questions, please write it in the chat and we will definitely answer them at the end of this live. Okay, Jenny. So when you walked in for your first day, can you explain, the steps that, you did on the first day when you came to Clear Passage?
yes. I first filled out a medical history
Hmm.
because I knew I had to be approved. The woman that referred me here was a palliative care patient, and she told me everything to expect. And she was right. When I walked in the door, I felt like I was home.
Hmm.
I was treated like a member of the family. Everybody was just kind, thoughtful, answering any questions. Uh, I felt like a weight had been lifted off my shoulders just getting here.
Hmm.
And then when I met the therapist, it was an hour long evaluation. She checked me from head to toe. She was looking at any possible problems.
Hmm.
They just did everything.
Wow. Wow.
Uh, then she actually started working on the scar tissue that she found. At first, I felt like she had radar in her hands because she was just going very gently over different things. And she'd slow down and she'd say, I can feel heat. I can feel this. I can feel that. Then she'd start working on it. And it's a very specialized program to break up the adhesions manually, no surgery, no drugs.
Mm.
Uh, when when I left that day, I had so much hope, and I came back, and it was a 2-hour program,
Mhm.
2 hours a day, because the first hour was finding out what they're going to do. Then after that, they were working on it,
Mhm.
and I was local, so I could spread it out uh, over like 2 weeks, 2 hours, and then a couple of days and 2 hours. And by the third time I was here, I was able to stand up straight. I
Wow.
didn't realize it, but I was being pulled forward by the adhesions.
Mhm.
I was walking like a little old lady, and that's not right.
Not for
Hey,
you,
21
Jenny.
years ago, I was young. I'm
Right.
81 now. I was 50, 58, 59, somewhere in
Mhm.
there.
Right. Right.
And I didn't want to be that person.
Yeah.
And they gave me back my life.
Mm.
And so when I came to work here, it was just actually, I called them because I couldn't think of anything. I've been in medicine since I was 17.
Mhm.
And to actually be able to say I worked at Clear Passage, I was so proud, and I'm still proud of it.
Mhm.
It's become a little bit of an obsession with me because, well, it is. When I had to have breast cancer and all the doctors were coming and going, I was handing out cards like you wouldn't believe and explaining to them what Clear Passage did. And they were all so interested because they never, even though we've been published, they don't have the time to read all the information they get.
Right. Right.
So I ended up with pneumonia after COVID.
Mhm.
I went through a lot of books and a lot of cards. And uh, during a colonoscopy, I had anesthesiologists all grouped around my table, uh, explaining to them what we did.
Mhm.
I had nurses that came back and wanted more information.
Wow.
Information is power.
So you're an advocate for clear passage. That is wonderful. Earlier in your conversation, you minute that you talked about small bowel obstructions are caused by adhesions. What can you tell us about adhesions and how do we treat adhesions here at Clear Passage?
Adhesions are caused by inflammation, trauma, and surgery. Surgery is the number one
Mm-hmm.
cause.
Mm-hmm.
Uh, when you have surgery, your body produces collagen.
Mm-hmm.
This collagen changes in molecular structure and becomes like internal scar tissue. I used to tell people about when you skin your knee,
Mm-hmm.
you get that scab. Once the scab falls off, that's scar tissue. This is internal scar tissue,
Mm-hmm.
and it has to be broken up. What it does is it binds around the intestines and causes them not to be able to work the way they are meant to.
Mm-hmm.
Uh, you'll start with having pain caused by them, then it just gets more and more, and doctors don't have answers. But that internal scar tissue is it's vicious.
Mm-hmm.
You know, I don't have another word for it.
Right, right. Well, I mean, your word vicious sounds pretty accurate after everything that you have been through. And
Yeah.
I mean, just to see you sitting here at 81, you are beautiful. You look marvelous. Just know
Oh,
that.
you've always been so sweet.
So
Everybody
can you
there
hmm?
cares.
Huh?
We all care so much.
Right, right.
It
So can
killed
you
me
explain about
have
the
to retire, but
hmm
we've still got us. I still say we because
right,
Clear Passage is a part of me,
right, hmm
and
hmm
I wouldn't be here without them,
right, right,
and I know it.
right. So after treatment and everything you've been through, how's your abdomen now? How does it feel?
Soft. It's not all
Lovely.
swollen and hard. If I cheat, and I will admit occasionally I am not the best, but if I cheat, I go right back to what I know
Hmm.
and what I've been taught, and that those teachings are really, really important because it helps you get back on track.
Right, right.
And I got a lot of years to go.
Yes, you
And
do.
I can tell you, if anybody wants to talk to me, they're more than welcome to call into Clear Passage. You
Okay.
guys have my number.
All right.
I'll answer any questions.
Okay.
Uh, s- just stay away from that NG too.
Yes.
Get
Yeah.
stay out of the hospital. Get help.
Hmm.
It's here.
Okay. Well, let's talk about the process. Can you explain about the process of calling in the first time of being scheduled to be scheduled?
Sure.
What is that process like?
Okay. I called in. I don't remember who the receptionist was, but she was very, very sweet. She, at that time, I was not as computer literate as I am now, which is still questionable, but she sent me the forms.
Hmm.
I filled them out and I actually brought them here. And then I had a telephone interview. I had a therapist that looked everything over, and we got medical records.
Hmm.
I keep records from everything. I am a compulsive saver. So I had all my surgical reports, but she said if I didn't have, they could get them for me.
Hmm.
And she worked with me every step of the way. I put down my deposit. I came and life has changed.
Awesome. Awesome. So, what feeling would you use to describe CP?
Freedom,
Awesome. I like that. Freedom.
safety.
Hmm.
Uh, I never thought I would live this long.
Mm,
And
mm.
I plan on at least 10 more years.
All right. Awesome. I love that. I love hearing that. So, do you have anything else you would like to add before we go to the questions that's been posted by our viewers?
I can't think of anything. Is there anything that I might have missed?
No, I mean, your story is heart feeling, heart touching, just what you have been through. And actually, one of the questions we have, it says, why did Jenny have 10 surgeries and what type of
Uh,
surgeries were they? And then
well,
they say
let's
you
see. I
joined
had
the
bleeding ulcers. I had something called a Nissen fundoplication because the doctor wanted to throw in an extra surgery. Gallbladder, appendix, a kidney removed, hysterectomy. Oh, for the hysterectomy, a year later, I had an oophorectomy because I had pain in my lower left quadrant. When they got in there, they found that an intestine had been pulled through my ovary. So they had to remove a piece of intestine. I didn't count that in the 4 surgeries for
Mm,
bowel obstruction because it wasn't a true bowel obstruction. It just, I lost an ovary and some intestines. But that was the first time I found out what adhesions could do. But
okay.
I didn't have any idea about the
Mm,
bowel obstructions.
right,
That's
right.
just pain. That was over 15 years of pain and doctors patting me on the head and making me feel insignificant and feel like they didn't believe me, that
Hmm.
I was making it up.
Hmm.
And let me tell you, that pain is something you cannot make up.
Right, right. Hmm.
So,
Well, okay. Well, another question we have, it says, do I need an MD referral to be treated? My MD probably won't prescribe it.
no, you don't need a doctor referral.
Right.
Uh, we can tell by your history
Hmm.
whether you have adhesions, and the therapist, of course, will tell you where they are. It would be nice if you could have your doctor look at the website because
Hmm.
it's a whole section for him and he can educate himself on what we do, but you don't need it. We treat many, many people
Hmm.
without a referral.
Right, we do. And the referral will help if you want to possibly look at getting reimbursement from insurance. I can tell you that.
Yes, it does.
We
And I
do
know
everything
you
we
work a lot
can.
with your patients on that.
Right. We do a lot, everything we can on our end to help patients get reimbursed from their insurance company. I do give them an itemized super bill at the end of their treatment where they can, send it to their insurance company. And if you have a referral from your primary care, that will help with the reimbursement process.
Yes,
It is not needed to be treated by Clear Passage, but it is helpful for insurance purposes.
correct.
Thank you. And then another question, it says, I'm not local. What would the treatment protocol look like? Okay.
The treatment protocol would be to complete a medical history. Now, we have 9 clinics in the United States
Hmm.
and 2 in the United Kingdom.
Hmm.
So you could go to any one of our clinics that is closer to you.
Hmm.
Once you fill out your medical history, it then goes to the physical therapist. The physical therapist will go over everything. And then at that point, we would talk to you, go if there's any questions uh, in your medical history. We want to know everything there is about you. We want to know you,
Right. Right. Hmm.
and the better we know you, the better we can help.
Hmm.
So once we have their approval, then we go through the whole scheduling there's a lot many steps at that point, but
Hmm.
it's all one-on-one with the patient coordinator or the intake coordinator, and uh, we help you. That's our
Right.
job.
Right. And speaking of the locations, just to let you know that Clear Passage is located, the headquarters this is here in Gainesville, Florida. We have a
Yay.
location in St. Louis, Missouri, Dallas, Texas, the metro LA area in Pasadena, Manhattan, New York, Encinitas, California, Oakland, California, Rochester, Michigan, London, and in Canterbury. Those are our
Yay.
locations. Yes.
I'm just so proud.
Yes. There's one other question. It's a 9 clinics in the US. Do I have to choose or does each clinic treat a specific diagnosis? I
No,
can
we
tell you that all of our clinics treat everything.
right.
We They are trained in the worm technique, which is the clear passage, what clear passage does. And they come and they are treated, they treat any of our patients. They come, they are trained here in this facility in Gainesville. It's a 2 week extensive training. They do not leave this facility until the worms know that they are ready to treat clear passage patients, and they treat whatever condition that they need to treat. So there's no specific clinic that treats just infertility or treats small bowel. You can go to any one of our clinics and be treated for any condition that you have.
That's true.
Mhm.
Where all of our girls are wonderful.
Yes, they are. Yes, they are. One final question. It says Jenny said treatment was spread over a few weeks. If I go to a clinic, how many weeks do I need to stay?
No, mine was spread over a few weeks. Most people come for 5 days. They
Hmm.
start on Monday,
Hmm.
and it's 4 hours a day for 5 days.
Hmm.
Once in a very great while, um, you will get somebody that has had so many surgeries, so much going on that they may need additional time. If that is true, the therapist would make a note of it on the medical history, and we would discuss it after it comes back from the therapist.
Hmm. Yes, our treatment is spread out over 5 days, 4 hours a day, and we try to stay within that time, especially you know, if a patient is coming from out of town. But if it does need to be spread out, we do spread out treatment. And we have a lot of local patients that come in. And Jenny just happened to be one of the local patients that came in. So she was able to spread her treatment out over a couple of weeks. But we do, it's recommended for 5 days, 4 hours a day. Okay. Is there anything else, Jenny, you would like to add to this or anything you would like to
This
say?
is the best thing I ever did for myself. Uh, and I felt it was something I had to do for myself
Hmm.
to have any quality of life. I remember being carried out of a bathroom of a very nice restaurant
Mm,
because an attack hit right after I ordered my dinner, and it was my anniversary.
mm,
Ended up in the bathroom, curled up on the floor. EMTs had to take me from there to the hospital. I can't imagine anything like that happening again.
mm.
And I don't want it to happen to anybody else.
Right, right. And that is, we understand that. We're here for you, Jenny. And as Jenny mentioned earlier, if anyone would like to speak to Jenny, they are more than welcome to call here at the office at 352-336-1433. And we will get in touch with Jenny to hook y'all up to talk. Jenny is, like I said earlier, you're an advocate for Clear Passage because they have helped you and you have helped them over the years. You're a beautiful woman. We love you. We appreciate everything you have done and everything you continue to do for Clear Passage. And always know that we're here for you if you ever need us.
I
And
know
that's
that.
for anyone that's facing either small bowel, infertility, anything you're facing, just that you think Clear Passage can help with, reach out to us and we will do our best to make your life better for you. I want to thank everyone for their time. If you have no other comments, Jenny.
Just read everything you can and check it out, fill out the medical history, and let's see how we can help you.
All righty. Thank you so much for your time this morning. Y'all go out and have a beautiful day. And remember, Clear Passages for here for you if you need anything. Thank you.
Bye bye now.
Bye bye.